Hi everyone, and welcome to D-Talk, a podcast by Ajanta Pharma, where we dive into meaningful conversations about diabetes and overall health. I am your host, Dr. Ayushi Shah. So, whether you are a patient, caregiver, or healthcare professional, this podcast is here to inform and inspire. Today, we are honored to be joined by leading expert in diabetology, Dr. Chani Seth. We are thrilled to have her with us.
Thank you. I'm Dr. Chani Seth. I'm a consultant endocrinologist practicing in Mira Road at Indra Hospital. Hi, everyone.
Thank you, ma'am, for that introduction.
So, we need to understand something about insulin. So, insulin is basically a hormone which is produced by pancreas, which is an organ in our stomach. And this insulin is responsible for controlling our blood sugars. So, the basic difference between type 1 and type 2 diabetes is the number of insulin cells. So, what happens in type 1 diabetes? It's an autoimmune disease, meaning your own immune system is attacking your insulin cells, and almost 100% of your insulin cells are lost in type 1 diabetes. Usually we see that in children, but it can happen at any age. So these people will require insulin from outside for life. Now, type 2 diabetes, there are insulin cells there. They are not 100% damaged, but you may have lost about 50% of these when you get to know that you have type 2 diabetes. But along with this, there is another thing which is called insulin resistance. It means that there is insulin in the body, but it's not able to act. So type 2 diabetes is the most common kind that you see daily, and this can happen at any age, and this is the one which is related to lifestyle, diet, exercise. And type 2 diabetes and type 1 diabetes, there's actually a type 1.5 also. So that is also an autoimmune condition, but there the 100% cells are not lost. So it's also somewhere in between type 1 and type 2. Now, coming to the gestational diabetes. So gestational diabetes means it happens in pregnancy. So after 24 weeks of pregnancy, the women produce hormones which cause insulin resistance. So these pregnancy hormones are the ones which are causing insulin resistance and increasing the blood sugar levels. So here, 95% of the times, as soon as the baby is out, baby is delivered, this gestational diabetes goes away. But again, women need to be careful because this means that they are at future risk of developing type 2 diabetes. So I think broadly, this is what is type 1, type 2, and gestational. So as I mentioned, for our type 1 diabetics, insulin is recommended for life at the onset itself. Even for gestational diabetes, insulin is the safest thing to give. So for gestational diabetes, which is not controlled with diet and exercise, insulin is recommended. Coming to type 2 diabetes. Now, in type 2 diabetes, it depends on the situation. So sometimes we see a patient with signs of insulin deficiency, which means that patient has had weight loss, they are having thinning of their arms and legs, which means they've lost their muscle and fat. Then they can have increased in their urination, increased in their thirst. So in such patients, we usually give them insulin. Other than that, if they have very high sugars at the onset, HbA1c, the 3-month average, and the sugar levels are very high, say more than 250, then also insulin is recommended. Now, in certain situations, like when the patient is hospitalized, patient is undergoing surgery, patient has some medication like steroids, which will increase the sugar. In these situations, we give insulin temporarily. In type 2 diabetic patients, where the duration of diabetes is very long, So with age, those insulin cells decrease, and if the insulin cells have decreased a lot, they are not responding to the oral medication. So in such cases also, we initiate insulin, which is usually for life. So broadly, I would say they are long acting and short acting. So long acting, there are ultra long acting. So these are the ones which are called basal insulins, or insulins which are basically controlling your fasting blood sugar. So initially we used to have some basal insulins which used to act for 12 to 14 hours. So you have to take it twice a day. Then we had the ones which work for 24 hours. Now we have ones which work for 36 hours. And soon we will also have once weekly insulin also. So one is your basal insulin, or long and ultra long acting insulin, to control the fasting blood sugar. The other kind is the short or rapid acting. So this other kind is basically to control your post-meal blood sugars. So again, we have different varieties in this. There are ones which can act in 5 minutes, ones which can act in 15 to 30 minutes. So broadly, long acting and short acting is what we need to understand. So actually, that's a very big myth. Insulin is not at all difficult or painful. So insulin is available as of now in the form of an injection. So earlier we used to have syringes, but now we have simple insulin pens. It just looks like your normal pen. So these pens have markings on them. So it is very accurate because you can see the markings and inject it. So this is taken in the fat. So basically in the stomach, thigh, or upper arm, the insulin injection is taken, and we have very fine needles nowadays, so it is not painful at all. There is no blood, there is no pricking sensation at all. So insulin, there are children, 4 5 year old children, to whom we are giving insulin 4 times a day. Even they learn how to take insulin themselves, so it is not at all hard to take insulin, and not at all painful. See, any diabetes medication that you take could have a side effect called low sugar. So whenever you are taking extra medication, whether oral or insulin, than your requirement, or you have not eaten your food, or you have exercised too much, you can get low sugar. So any anti-diabetic agent can give you low sugar, but you need to remember how to correct low sugar with 2 to 3 teaspoons of glucose or sugar. So that is one side effect which is common to all, but it can be taken care of. Other than that, insulin can cause some weight gain. But as I mentioned, that most of these patients have had weight loss due to insulin deficiency. So actually it is beneficial in some of our patients. If insulin is taken wrongly, or if you are continuously taking insulin on the same site on the stomach, it can cause some bumps. So this is called as lipohypertrophy, because skin of that area grows. So again, if you take the insulin properly, keep changing the site, this kind of side effect will not happen. The oral drugs can give you commonly nausea, vomiting, gastric side effects, then depending on the drugs, but these are the most common side effects that we see.
Dr. Seth, it has been a truly enlightening conversation with you. As we wrap up, what's the one key takeaway you'd like to leave our listeners with?
I would just like to tell them that keep monitoring your sugar levels. You might not have symptoms of high sugars, so keep monitoring. Take the treatment timely. If doctor is initiating insulin, please don't delay it. Don't wait for organ damage to happen, and keep monitoring. Take your medication on time. That's it.
That was a wonderful takeaway. We are truly grateful for your time, Dr. Seth. The knowledge you have shared has been informative, and I'm sure our listeners have gained a lot from this conversation. And thank you to everyone listening to Detox, brought to you by Ajanta Pharma. Stay tuned for more expert led conversations. Thanks a lot.